My name is Dr. Sean Price. Been doing a video series here on hormones and adrenal function and hormone imbalances. And what I want to talk about now is determination of adrenal fatigue. Now, there's some controversy in healthcare. Medically, adrenal fatigue syndrome is not something that is medically recognized. So adrenal malfunction might be something better, but typically medically they're looking more towards Cushing's, adrenal failure, things along those lines. In functional nutrition and what we do in our office with a natural approach, we look at optimal function. So adrenal fatigue we have found in our office to be a very, very real thing. So the way that we test for this, there's two ways to test for cortisol levels and for hormone levels. Number one is through serum or blood draws, and number two is through saliva. There's another controversy there, which is better, serum or saliva. What I found in my practice and what I prefer is the saliva. I find that it's what's been used more metabolically, it's more metabolically accurate, and it's easier to test for the patients. Serum levels a lot of times will show what's available in the blood, but they may not show what the body is actually utilizing. So we use saliva testing in our office, and what we do is we'll have a patient take home a test kit. In that test kit there are 4 vials. In each of those vials you give a saliva sample, and you do one early in the morning, one around noon, one around 3, and then one in the evening. And what should happen is your hypothalamus is the part of the brain that recognizes the environment and it controls the cycles in the brain. So sleep-wake cycle, sexual desire, appetite, things along those lines come from the hypothalamus. So the hypothalamus sends a signal to the pituitary for the pituitary to signal the adrenals to release their hormones, one of those being cortisol. So in the morning, you should have a pretty high level of cortisol because you want to wake up and be ready to go. Now keep in mind that cortisol and melatonin are counter-related with each other. So if cortisol is high, melatonin is low. Remember, melatonin helps you sleep. So you have cortisol is high in the morning, so melatonin is going to be low. Then it's going to come down a little bit around noon. It's going to come down a little bit further late in the afternoon, and then should bottom out in the evening. Okay? So as that goes down, again, your melatonin levels go up, so by the evening you're ready to go to sleep and get a good night's sleep. This is a normal hypothalamic pituitary adrenal axis, what we call the HPA axis. So that pattern tells me that the hypothalamus and the pituitary are communicating properly with the adrenal glands. If I run this test and the chart comes back looking more like this, then that tells me that in the morning and in the early afternoon, the patient has low cortisol levels, and that's going to look like somebody who wakes up fatigued and tired, even though they just got a full night's sleep. They just don't ever feel refreshed, and then they get a little bit more tired as the day goes on, and they just flatline throughout the day. Okay. If I see a test that looks like this, just flatlined all the way across, to be a low adrenal syndrome where the patient has very, very low cortisol. If I get a test that comes back like this and then goes up, that tells me that the hypothalamic pituitary adrenal axis is not working properly. So not only do we have a cortisol issue and an adrenal issue, we have a HPA axis issue. So there's a whole lot of information that we get from this saliva test, and that provides us with a whole lot of details about what we can do nutritionally to try to support and normalize those functions. In that test, we also get our estrogen levels, our testosterone, our DHEA, our progesterone, all those other factors. So this is the testing that we do, and this is how we determine where the adrenal function is. And if you want to see how important that adrenal function is to normal hormone production, go back and watch the other 2 videos that we've done. All right, have a great day.